Hi, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, January 7th, 2022. Welcome to the new year. Welcome to you. Welcome to Ed Brubaker, our Living Branches President and CEO. Here we are again on Zoom for our monthly filming, I guess.
Yes, and good afternoon again, Alex. Yeah, it's Zoom today, partly because of the COVID positivity rates. And it is relatively easy to do it this way. But at the end of the day, the story on Action News, so to speak, at the moment today in Living Branches is we have had surges of significance in COVID positivity rates. And I was just on a call today with the local facilities and local hospital, and everywhere is experiencing maybe not the exact numbers, but everyone is experiencing high COVID positivity amongst their staff, among residents or patients. And it is a very, very challenging time right now.
I think, did you tell me earlier that the positivity rate in Montgomery County is above 25%, which is a number we've never seen?
Yeah, I just checked, I think it was yesterday or Wednesday after we had gotten an update, weekly update that I get. In that weekly update, it was 25% and 27% in Bucks County. I didn't check Bucks County, but Montgomery County, I think a day or two ago, had even gone up higher to 27%. So yeah, these are numbers that we have never seen in this pandemic before. Now we'll talk a bit about Omicron and the reality of how sick people get and that kind of thing. But at the end of the day, we have never seen rates like this. And so I think I've said on this video before and said in other places, the biggest influencer of our own experience is what's happening in the wider community. And so when the wider community goes up, we can do as much as we can and work hard, but there's only so much we can do when the positivity rate is high in the community. And it has never been this high in Montgomery County or Bucks County for the entire pandemic.
Well, let me go ahead and summarize, I think, where we are with our case counts. At Dock Woods, I believe we have one resident in our apartments testing positive. We have 2 residents in the villas. We have 3 residents in Dock Manor. We have 1 resident in Harmony House, 5 between Dock Terrace and Country Cottage. And then we have 26 staff persons who are testing positive right now for COVID. At Souderton, we have 4 residents in the apartments, 6 residents in the villa, 3 residents in healthcare, and 20 staff persons testing positive. And then at the Willows, we still have 2 staff persons testing positive. I think they're almost finished with their quarantine and will be back to work in the next couple of days. But this is numbers that we haven't seen in quite a while.
Yeah, that's exactly right. And we want to talk too about the level of severity. And I would again reemphasize over and over again, the vaccine helps. Having COVID previously helps. Having the booster helps. These are all things that are really, really important to do. And I focus more on the vaccine and the booster, not so much getting COVID, even though that can protect people, but getting the vaccine and getting the booster. And I believe we still have a clinic scheduled. I believe it's still happening next Thursday, if I'm not mistaken, depending on what's happening this next week. We may or may not need to make some changes, but right now I think we're still scheduled. Is that correct, for next Thursday for a booster clinic? So I would encourage people that are eligible to come and get that, residents or staff. Please don't hesitate to get it, because there is no question the vaccine and the booster has shown that it helps not just people in Living Branches, but in the wider population. We can all find stories to prove our own point if we're oriented to getting the vaccine, or if we're not oriented to get vaccine. There's always those one-off stories that we can find to say, well, so-and-so got it and they were vaccinated and boosted and et cetera, et cetera. And there's still people that can die who have been vaccinated. But overwhelmingly, when you look at the big picture, the big picture and the statistics there absolutely, unquestionably show that if you are vaccinated and boosted, you may well get COVID, but the chance of you getting really sick, sick enough to go to the hospital, and sick enough to go to the hospital and potentially even pass away are drastically reduced if you have the vaccine and are boosted. And so while we are seeing a great number of residents and staff, the ones that are vaccinated and boosted are having mild symptoms primarily.
Yeah.
And some even have minimal to no symptoms. We do have 2 residents right now in residential living on one of our campuses, neither who were vaccinated. And in both cases, they are very, very sick. And we hope and pray for the best in that situation. But unfortunately, they are in a challenging situation right now and are unvaccinated. And so it just, again, for me, reiterates, let's do the right thing, continue to work at getting vaccinated, and hope and pray too for the persons that are in challenging situations.
I think the other impact that this has, it's one thing for us to say we have, almost 50 staff persons who are out right now with COVID, but we have almost an equal number out who, because they've been exposed to family members or something like that, and they're not allowed at work right now because they're exposed. So the total number of staff persons out is very high.
Yeah, it's over 100 right now. And so you can see why, and that's across all disciplines too. It's not just in one department or one campus. But that shows how serious it is. And we're putting needs out there right now. I know my wife and I are coming in and helping on Saturday at one campus and Sunday at another. And many other staff people are volunteering on weekends or during the week as well, doing things that are outside of their normal responsibilities, because we need, right in this period of time, till we start cycling staff back in who have gone through their COVID protocols. And so we're also evaluating the health directives from the state to see what has changed. And so how can we work at those things to bring people back to work? Some of those criteria have changed as well. And so it's a scramble right now, but we're hoping that as we go through the process and people start cycling back in, that we can start to calm this wave down a bit more. But it has big implications for our staff and for our residents who we serve, because as we said, the COVID positivity rate in the community is very high. Students are getting it in the schools and bringing it at home and all those kinds of things. And so when there is an exposure, no matter what it is, particularly household exposures, our staff need to declare that, and that becomes something we investigate and determine what the situation implies. So it is very serious from a staffing standpoint, because we were already challenged because of the realities of staffing right now, in not just in Living Branches, but the wider world. Not that it's a huge comfort, but the reality is we're in the same boat with everyone else in our industry, everyone else across the world. And so while we would love to not be in the same boat, and everyone would love to be in a different boat, I'm sure, the reality is that's the experience of so many people today. And it is challenging, but I will say this, our staff is doing incredible work. I was here last weekend on Sunday on a split holiday weekend, visiting the campuses, and people were still good humored and working hard and doing what they needed to do. And so very good stuff, and really good to see the commitment and perseverance of our staff, and frankly, and our residents and families.
Yeah. I've been talking a lot this last 10 days, maybe with our testing team, a lot more than I normally would have. And one of the things that they revealed to me that I wasn't maybe tuned into was that a number of staff and residents have been surprised because, they found out they were exposed because they were, at an event or something with persons who later turned positive. And so they've come to us for testing, and they test negative on their test on day 2. But the testing protocol is you also need to get tested somewhere between day 5 and 7. And what we're seeing now is that's when they're turning positive, so many of them. And it's been a surprise to people because I think they thought, oh, I tested negative, I'm fine, not realizing it can take time to develop the virus into like something that impacts you and can be measured.
Yeah, that's absolutely right. And I think the CDC is reducing some of that because they're finding that the width, if you will, before symptoms and after symptoms for Omicron may be a little different than previous variants of the virus. But absolutely, there's a cook period, so to speak. That's not really what it's called, but the incubation period would be. And so that's why that testing is so important. Now, the flip side too is if people don't know that they're being exposed, they could be having multiple exposures because just because they knew of one, because someone told them about it, they could also be interacting with other people that they don't know about. And so to be able to pinpoint down and say, well, this contact tracing is what, unless you're staying at home all the time, too many people are interacting with too many people. And so you really don't know where your exposure is. So there's so many different places it can come in. In the early days of the pandemic, when we were restricting visitors, people would say, well, we know where it came from. It came from your staff. And in general, that could be pretty true, although it could have been an outside contractor or someone like that as well, a nurse or a doctor or whoever. But that concept was more true then. Today, we still have visitors coming in. We can't restrict visitors from a regulatory standpoint during an outbreak. I would say most people reduce their visits during an outbreak. There's no question about that. But there's so many different people that are coming on our campus today to unequivocally say where a person may have received it. I would say that is untrue. I would also say, as a general rule, I have observed that visitors may not be quite as conscientious, perhaps, or wearing their mask. And this, unfortunately, it may offend some people watching the video because I know there are some that really do it well. But I know when people are visiting mom or dad, I've seen a few too many chin aprons on people. And I know for us as staff, we really try to enforce that with staff and say, get that up over your mouth and nose. But those are some of the realities too. And I don't want to just excuse it as human nature, but I also know that those things happen. Those are the practical realities. So that's one of the challenges now. There's so many different methodologies that things can come in. But again, the positive is that if you are vaccinated and boosted, the evidence we have right now is that the severity of Omicron is much reduced. And that, to me, continues to be very positive news on the outlook of COVID.
It might be worth pointing out to pointing out to people that we're seeing different symptoms now than we were seeing in some cases in the first round. So it's not so much cough we're hearing about or fever. We're hearing about, I had a sore throat, my back hurt, my eyes were watering, I had body aches. So it's the number of people who said, I didn't think I had COVID, it's just a cold, or it was just my allergies. I think if I had $1 for every time I heard that, I probably wouldn't be here right now.
Yeah, that's right. And I would say too, there is in COVID, in the COVID world, there is no such thing as just a cold, in my opinion. I mean, any of those kind of snivels needs to get your antennas up and say, what's going on here. But yeah, you're absolutely right. And that was true at the beginning of the pandemic too. There were certain things we were looking for, and then, oh, you're losing your taste, you're losing your smell. So there is that continued evolution of symptoms as well.
Yeah. Well, certainly this is a hard month. We've been talking about it since the holidays started, really, but Christmas and New Year's, it's just exploded. But I think you referenced earlier that it's not as scary as it was. It's got different challenges, to be sure, but that level of fear doesn't seem to be there in the same way that there was last year.
Yeah, there's no question about it. And I think you can just say that in the wider community too. The fact that people didn't shut down over Christmas this year when they did last year just shows that people aren't as scared, and maybe they're just tired of it too. But I think we've learned too that us being tired of something doesn't mean that it will go away.
No, it doesn't.
I think that is a mistake for people to believe that just because I'm tired of it doesn't mean it's going to bother me anymore. And so we need to look at that. But there's no question about that. Having said that, though, when I would say the stress level for myself or you or any of our other staff persons, other leaders, I can see it in people's faces and their eyes. The stress level, I wouldn't say is any less because there's staffing challenges, there's management problems, there's just a lot of things to deal with. But the kind of the fear and the stress of the disease, we have the vaccines, we have treatments perhaps at times, but there's things that we can do. We understand more how the disease spread. So that fear factor is not so much there, but the resulting stress, I would suggest, what we're reacting to is different, but the stress that it's caused and the challenge I see that our staff leaders are going through definitely is every bit as great as it was in the past. It's just different as to what they're reacting to.
Yeah.
So we absolutely are concerned and trying to pay attention to those things too, to make sure that we take care of ourselves, take care of our staff, and make sure that we pay attention to those stressors.
I had some leaders from one of the campuses contact me earlier in the week and say, hey, we want to send a memo out to our residents and just sort of apologize that our services are not what we want them to be, and let them know a little bit about what's happening and some of these stressors with staff being out, et cetera. And I said, oh, that's a lovely idea. And then no one had time to actually write the memo. So maybe we could just say, please give us a little bit of grace. Hopefully we will, and they already have, I mean, our residents and our families already have been, of course, but we're getting through this as quickly as we can with as least impact to you, our dear residents, as we possibly can. But this is just unprecedented.
Yeah, it really is. And as you said, overall, people are giving grace and yeah, forgiveness and whatnot as we go forward. And so, yeah, that's just a case in point, and hopefully people can see it in the video and continue to. I think I said on an earlier video for a resident meeting, if you do think about it when you see a staff person, be giving them affirmation too for hanging in there, and I say that to residents as well. Thank you for hanging in there, because it's been a challenge when activities were shut down or you had to take meals in your room again. I mean, I know Lucy and I are taking meals in Dock Terrace and helping out, I guess, with bringing people to the dining room still at Souderton on Sunday. But the point is that those things are challenging to our residents as well. And so we appreciate the long suffering that's happening on everyone's part during this time.
Yes, if I'm filling in and providing a meal or helping with transportation, I know that I'm not doing as good a job as the person who normally does it. No question about that.
Yeah, that's what I wanted to be clear, that I'm not a nurse. I can't do nursing related things. So you press that call light and need to go to the bathroom, I'm going to have to find an expert that can help with that.
Yes, definitely. So, well, any final thoughts for today?
Yeah, I think it's just that we are slugging through this. We are working at it. And I've said this before, and I'll say it again. We will get through this together. I read again about the Stockdale paradox and the idea of hope for the future. We don't know when it's going to get better and when it's going to become an endemic disease, but we will eventually get to the other side. It may not be by next week or next month or whatever it is, but someday things will be different. And when I think back to the 1918 pandemic, well, they didn't have social media, and that was maybe a good thing actually, because I get tired of that sometimes. But the point is, there were so many different ways that they were communicating, and differently than we do, and in some ways didn't have near the knowledge that we do. And so at some point, that flu became endemic and they got through it, and were learning to live their lives in different ways. And Someone commented the other day, or I read an article about, the 1918 strains are still impacting us at times today. So
Yes.
that reality of living with the flu, at some point, it may be that way that we live with COVID. But in the meantime, it's challenging, but we will get through this. We will get through to the other side. Whatever that looks like, it will look different than before, but we will get to a better place than we are today. Right now, it's difficult, but together we will get to a better space. And I'm confident of that. And I wouldn't want to work with any other group of people going through this. It's a great group of people committed to the organization, committed to our residents, to our mission, and our residents committed to us. And I appreciate that so very, very much.
Yeah, absolutely. It's been kind of humbling to, being in those meetings with the nurses, et cetera, who are down there doing every single thing they possibly can, short-staffed. You really see the love and commitment that you've talked about so many times. Yeah. Well, have a good weekend. Thank you everyone for watching. Again, if you have any questions, please feel free to send them. You can email them to coronavirusquestions@livingbranches.org. We'll be happy to answer them. You can also check our website, livingbranches.org. Thank you so much.